Hello, everyone, and welcome to the U26 in London. My name is David Andrea, urologist from Vienna, and it's my distinguished pleasure to welcome with us today a close friend of mine, Professor Francesco Del Giudice from the University of Rome. Francesco, thank you very much for being with us today. I would like to discuss with you the CATALYST trial. You, as a PI of this trial, can you give us a brief summary of what the trial is about? And the trial opened lately last year. Can you give us a brief also first impressions of where is the direction, where is the trial going?
Sure. First of all, thank you, David. You are indeed a very close friend and colleague of mine. It's an honor to have this discussion today. So CATALYST, yes, is finally live. It was launched in December 2025 and it's kept going. We will eventually tell you more in a few seconds. So CATALYST trial is a pharmaceutical interventional randomized clinical trial with a design of non-inferiority. So what we are questioning here is trying to avoid those unnecessary second look and resection. With nowadays, from 2008, this kind of recommendation is on the EU guidelines with no eventual trial trying to questioning this indication itself. So the reason why today we need to have a re-TURBT is that because we are unsure about the quality of our primary resection. So we have two main pitfalls, which is the understaging of T2 and the persistent disease after the primary resection, which can, boost up to 70% in some series worldwide. So the idea is to combine the approach of a preoperative MRI of the bladder with the VI-RADS score determination in order to assess the depth, the inclusion only of non-muscle invasive VI-RADS score 2, and then eventually to include an intraoperative tool like PDD and blue light to make sure about the resection margins, make sure about not to miss those tiny papillary lesion overload, and to eventually to increase the rate of your carcinoma in situ detection. So this is pretty much is a trial about the quality of the resection. So our primary aim will be the very first follow-up cystoscopy in the two arms. And the experimental arm basically is having a MRI, a PDD TURBT without a secondary resection for those high risk for which is indicated, of course, having a second look and resection. And that's pretty much about the design. And if you want more about the enrollment status, we were able finally to enroll the first patient on the 22nd of December 2025. So far, we have been screening up to 30 patients that had undergo MRI. Some of these are, on the waiting list for having the PRDT or white light TURBT according to the standard or experimental arm. What we find out interesting is that so far we were able to officially enroll only 7 patients. And this is most of the time because of the information coming from the cystoscopy. Mm-hmm. So cystoscopy, even if it's done by an expert surgeon or by a resident, is incredibly what we are finding. That the findings are completely not overlapping with the MRI findings sometimes. And that sometimes ends up even with patients that do not undergo surgery because the MRI is completely negative, for example. So this is something interesting as a very, very early results that we are getting from there.
That's very interesting, and it indeed shows the limitations of the cystoscopy itself. So one last question. This trial started as a single-center trial. Now you're expanding to multi-center. Is this correct?
That is correct. So what is really good about pharmaceutical trial in Europe is that the European Medical Agency has this platform which is called CTIS, and they allow you with a substantial modification to the trial to expand multicentric. It's quite a fair process which take up to a couple of months. And yes, this is our aim, especially to speed up the enrollment process, which will aim for 327 patients in 3 years. So it's quite a big burden of patients, especially if you have a lot of dropouts. So we definitely want to have more centering on board. At the beginning, it will be mostly Italian, and hopefully it might be European very soon.
Excellent. So thank you very much, and congratulations on this very important trial. We're definitely looking forward to meet you next year to have more details on the data. And meanwhile, have a nice congress and see you soon. Stay tuned.
Thank you very much, David.
Thank you.
See you soon.